Good afternoon, everyone, and thank you for joining us today at our media advisory. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, our city's Emergency Operations Center Director. As you know, the province of Ontario entered the first stage of reopening plan on Friday, June the 11th at 12:01 a.m. Outdoor gatherings of up to 10 people and patio dining of up to 4 people per table are among the activities now permitted. The capacity limits for outdoor dining are based on physical distancing requirements, as well as the capacity limit for the ability to keep 2 meters apart from others within the outdoor space, I should say. No indoor dining as yet, but certainly we're hoping that that's something that's not too far down the road. There are 167 approved patios under the city's outdoor dining district program for 2021. And the team is seeing more applications coming in every day. So lots of opportunity to get out and enjoy your favorite meal or beverage out on the patios throughout our city, basically everywhere in our city. So thank you for all the restaurateurs for their ongoing patience. And I hope that they're able to staff up and provide and supply the kind of things that people want to enjoy. And the weather has been great over this past weekend. A little rain this morning, but so far it looks like it's going to be another spectacular week. The reason why we're able to do that is in large part because of the rollout of the vaccine process across the province and across the country, in fact. Good news that Canada is leading, in terms of vaccinations throughout the world now in many respects, or at least number 2, and that's good news as well. Our effort in Hamilton continues to be very positive. We have about 414,436 doses administered within the city of Hamilton. 71% of that is the ages 18 plus have received their first dose. And from that group, about 14.5% have completed the vaccine series. And for the 12 and 17-year-old age group, about 50% have received their first dose. So that's moving along as well. Vaccinating community members remains a critical tool and top priority in stopping the spread of the virus in our community. So please, when you can, get accurate information and get the vaccine. It's the best way that you can serve your community and your family, yourself in terms of protection to help us get back to a sense of normalcy. So continue on that good work. We continue to expand access to the COVID vaccine throughout the launch of additional clinics, such as the mobile pop-up vaccination clinic and the ArcelorMittal-Dofasco Community Vaccine Clinic just opened up, and that's available to not only Dofasco employees, but all citizens in that area as well. So these additional clinics will result in increased access to the vaccine at locations in our city that are most in need. And certainly we hope you take advantage of that opportunity to get the vaccine. On June 15th and 16th at the Stony Creek Recreation Center, Public Health in partnership with the Ministry of Health, mobile teams will be hosting an outdoor mobile pop-up vaccination clinic. And beginning next Monday, June the 21st, 2021, in partnership with Hamilton Public Health, ArcelorMittal-Dofasco, as mentioned, will be hosting a community vaccine clinic at the center on Barton. This clinic expands the local vaccination program to include the region's largest private sector employer. And this clinic will be used on an ongoing basis to accommodate both ArcelorMittal-Dofasco employees and residents in the community who are eligible for their first or second dose of COVID-19 vaccine. So for more information on all of that, please visit hamilton.ca/vaccine booking to book your vaccine appointment. Please do your community duty, in my humble opinion. Get accurate information and then go and get the vaccine. It's the best that you can do to serve your community. I'm now going to pass it over to our Emergency Operations Center Director, Paul Johnson, for additional information in terms of local context and things that are open. Paul.
Thanks very much, Mr. Mayor. And it really is good to be talking more about what we can do and the new things that we're able to do and less restrictions than the other way we've been going previous to last Friday. So lots of positive feelings, and by all accounts, people on the weekend really enjoyed being able to get together with larger groups of people and get together and do some things that we haven't been able to do for a little while. And that will continue if we continue to do the right things as the mayor, and I know Dr. Richardson will talk about in terms of how we handle ourselves, continuing to follow public health measures, and also how we continue to drive our vaccine numbers further and further forward, not only with the first dose, but also now with second dose strategies. So as the mayor mentioned, a number of things are open. The biggest pieces that people were interested in clearly on the weekend were the retail, non-essential retail now open at a small capacity. There are lineups that ensue at a number of these establishments because it's at a 50% capacity at the moment. And obviously the outdoor dining was a huge hit as well. Just want to remind folks that for social gatherings or organized public events, it is up to 10 people now, but that is outdoors only. It is still prohibited to host social gatherings or indoor public events of any size. You must only gather indoors with members of your own household, or those very few exceptions, which could be caregivers or a single person who has connected up with your household. But for most of us, indoor gatherings not possible still. That comes in later stages of the reopening. From a city perspective, we are looking at opening our outdoor pools on June the 28th. So again, we will be going on our traditional timing for opening our outdoor pools based on logistics and staffing and all the rest, even though that there may be others opening their outdoor pools in a private capacity, because that is now allowed as well. It's great to see people being able to get outside and not only enjoy the outdoors, but now enjoy some organized activities outdoors, including fitness classes and some training that can occur from a recreational perspective. Reminder that if you are using city facilities, you will require a permit to do that if you're organizing some training in an outdoor capacity, and there are lots of restrictions around that, including the number of people that can be part of any one of those training cohorts. Also, just a reminder, if people are out doing that, for people that are interested also in watching, there are no spectators permitted for any of these activities, except in the case of where children under 18 are involved. Then one caregiver, and only one, can be present with that child for the training as well. But in terms of spectators, in terms of bringing more than one person from the family to watch what's going on, the answer is no. It's one caregiver only, and there will be lots of documentation that's required, including for case and contact tracing, should that be necessary. Just a reminder, when we are doing fitness out in these outdoor environments, it is a requirement to remain 3 meters apart when doing these fitness classes. So that will change a bit of the space. But we're looking forward to more and more things coming online. And as you've heard me say a number of times, our recreation staff are looking forward to opening outdoor pools. They are looking forward to our summer camps and our SUPE programs beginning as scheduled on July the 5th. That's if we can do our work, and through the next less than 21 days now, but through the rest of this month, making sure that those numbers remain low so that the province can move into step 2. Many people will have seen announcements that came out this afternoon that the province has released the framework in conjunction with other provinces in some cases to enable select professional and elite amateur sports leagues and events to return to play. There are 2 things I want to say about that to the general public right now. If you are not listed as one of those leagues or one of those tournaments or events that is happening, this does not apply to you. So for soccer associations and hockey associations and baseball associations at a very amateur level that are saying, hey, can we just start now? The answer is no. These are for, again, professional leagues. For all the TICAP fans out there will know we have now a resume of play start date for the Hamilton Tiger Cats and the CFL. And there are some elite amateur sports leagues that have been granted permission to get back to some training and potentially play. But there are very strict requirements. And those are also from a provincial level, working, as I say, with their provincial colleagues. So again, these are not local restrictions. So if you like what's happening with the way the return to play goes, it's the province's call on this. And if you dislike them, the province is the one that came out with that. So we will, as always, be aware of those. And we've worked with our elite programs and we've worked with our professional teams in particular throughout the pandemic, and have allowed them to train and do the things they needed to do at other times during that pandemic, and we will continue to do so. But these are provincial requirements that came out today, and as I say, for a very small number of athletes and the leagues. But it's the start of what will come later, which is the amateur and recreational level guidelines for getting back to team play. And that's when all of our summer sport leagues can know what those regulations look like and prepare themselves for a summertime of sports play that didn't happen last year in the same way. So this is exciting as well. number of people in the community were interested about drinking fountains. We are working at the city to get all of the drinking fountains up and operational. This is one of those tricky conversations to have, and I appreciate the work that Dr. Richardson and her team did in giving us guidance around this. We simply cannot clean these things after every use, so we are encouraging the public to remember that these are cleaned frequently, but they are not cleaned after every use. And so wherever possible, it's probably best to still have a bottle or something that you can fill rather than having your mouth to actually touch the fountain. And that you should practice good hand hygiene. If you have to touch a button to get the fountain to work and whatever else, make sure that you're cleaning your hands, not touching your face after those types of activities. But we do feel that there is a relatively low risk to this, talking to our public health colleagues. And so those all of the fountains will be open. If they're not open already, they'll be open very soon. And each fountain will be cleaned once daily, and there will be signage indicating that to the public as well. From an enforcement perspective, we're still out there enforcing what we need to be. The reality is most of our enforcement now is non-COVID-19 related. It has to do an awful lot with what's happening in our waterfall areas, people entering prohibited areas, climbing and descending the waterfalls, all that kind of stuff. We did have a few violations related to indoor gatherings, but they are very, very small compared to what we would normally see from a summer perspective. And I want to end by reminding folks that June is National Indigenous History Month and June 21st is National Indigenous Peoples Day. Of course, given where we are in terms of the steps of reopening, gatherings to recognize and celebrate Indigenous peoples can't happen in the way that we would like to for yet another year. But there is a virtual celebration that the city will be hosting on its YouTube channel on June the 21st at noon. And we'd encourage everybody to get involved, as we have through a number of things, including Remembrance Day and some other activities over this last 15, 16 months. Let's do that. Let's stand and sit and be joined virtually in solidarity with Indigenous peoples in our community. And then hopefully next year, we're able to get out in larger numbers and celebrate much more together. And as always, you can find lots more information on the city's website about all that we're doing to work in partnership with our Indigenous communities here in Hamilton. With that, I'll turn things over to Dr. Richardson.
Thanks so much, Paul. So, of course, the good news continues on the case count front with our trend downwards, continuing just a change of 11 cases from yesterday. And so now our local activity in terms of cases is at the lowest point, actually lower than the lowest point between waves 2 and 3, which is exactly where we wanted to be, because we know between waves 2 and 3, we didn't come down as far as we could have. And then we did have that challenge with there being a considerable number of people still in hospital in the ICUs. And of course, the challenges that happened during wave 3 in terms of the number of hospitalizations and the ICU capacity. So very good news that we're doing just as we need to do and going slowly and purposefully through this reopening process, and the case numbers continue to fall. With that, our new hospitalizations also are trending downward, and the average number of deaths occurring per day continues to be very low. Our 7-day moving average is at 24, with a weekly incidence per 100,000 of 28 and a weekly reproductive rate of 0.7, so well under 1.0. As of today, we have a total of 10 local outbreaks on our website. There's no new outbreaks today, and the size of these outbreaks continues to be lower. We've had only a couple of outbreaks in the past week that have more than 10 cases. Most of them continue to have just 2 to 5 cases within them, and most of those are still occurring in workplaces and in supportive housing. Our percent positivity on tests is also trending downwards. It's still at 5.3%. And so Hamilton does rank 3rd in the province overall in terms of percent positivity on our tests, according to the ISIS data. And so that's something we're watching closely as we go forward. And one of the things that we're looking at and people may wonder about is about that Delta variant prevalence. And we know that Public Health Ontario has switched the way it is doing its surveillance for this Delta variant. There's no specific test right now to use to screen for the Delta variant. And so they are doing a different type of surveillance, looking to estimate where it's at across the province. and where it might be accelerating in terms of its spread. So overall in Ontario, we have about 14% Delta prevalence when looking at the samples from May 16th to the 22nd, because this does use that whole genome sequencing method, which takes longer to produce. The science table, though, extrapolates it from other data, and they're estimating at this point, as of June the 14th, that our prevalence is probably up at about 40% across Ontario as a whole. So this is the concern as we go forward. Is this Delta variant, which seems to be even more transmissible than the Alpha variant was? And this is, of course, why vaccination and maintaining public health measures continues to be so important. In terms of vaccination at this point, we've now given 414,000 doses of vaccines for an estimated 71% of Hamiltonians over the age of 18 that have been vaccinated with one or more doses of vaccines. Particularly, over this month, our focus has been on youth once the vaccine was approved for those 12 to 17 years of age. And I'm happy to say that half of our youth have, at this point, which was meant to be the beginning of the youth vaccination push, half of our youth have already received a vaccine to date. And on the second dose front, 14.5% of adults have received a second vaccine as of today. For those of you who tuned into today's Board of Health meeting, you would have learned that we have adjusted our reporting around the percentage of eligible community members who've received a vaccine and our vaccine coverage that is updated on our webpage. This is to ensure that the way we're calculating vaccine coverage rates is the same as the way the province, the ministry, is calculating vaccine coverage rates. And so that we can be very clear where we're at in terms of the thresholds as we move forward with the Ontario government's reopening plan. So there's not going to be a change in the methodology used to report FSA coverage because that's linked to specific postal codes. But it used to be that we did not include in our reporting those people who hadn't reported a specific address when they booked for vaccine. The province was assuming all those people that didn't report a specific address did live in the community in which they got vaccinated. And so we've now adopted their method of making the assumption that they are getting vaccinated where they live. Of course, we don't know, though, what part of our community they might have been vaccinated in. And so that's why we have to maintain the FSA coverage methods. Also, the province was using the 2020 census to determine its population numbers. We were using the 2021. And so we've adjusted to do it exactly the same way that they do. Just if you want to know, what did that do in terms of our vaccination rates? It gave us about a 2% bump on average, but a little bit of variation across the different age groups as to the adjustments that were made. But it took us, for example, from 69% to 71% in terms of our vaccine coverage for today. Remembering too that second dose eligibility continues to open up. We are currently at the point where community members who are 70 years and older, as well as those who had their vaccine before April 18th, if it was Pfizer or Moderna, people are able to move up their second doses to earlier than the 16-week interval if you would like to do so. For those who received AstraZeneca for their first dose, there was also another announcement that occurred late on Saturday about second dose intervals for those who had a first dose of AstraZeneca. So we want to make sure people are given all the information they need in terms of making a decision. And once having had that, people can choose to book a second dose of AstraZeneca with an mRNA vaccine at an 8 to 12-week interval. Waiting the 12 weeks is thought to ultimately provide greater protection, but given the concerns about Delta variant, some people may want to get their second dose sooner. And so that option is open to individuals. So effective this morning, community members who got a first dose of AstraZeneca and want an mRNA vaccine can book their second dose through the provincial booking system or by going to a participating pharmacy between that 8 to 12-week interval. Those who want to have a second dose of AstraZeneca instead, and again, the interval there is 8 to 12 weeks, they can contact the pharmacy or primary care provider where they got their first dose and talk about what those options might be for them. They're looking for a pharmacy to go to. There is a spot on the provincial booking process where they can find pharmacies that do have AstraZeneca vaccine. We here in Hamilton, our primary care partners are holding a second dose AstraZeneca vaccine clinic for those members of the public who got a first dose during that time frame, 8 to 12 weeks ago. And that they could have gotten it through their primary care partner or through a pharmacy, whichever route that they have it. And they can go online at our vaccine booking site, www.hamilton.ca/vaccine booking, and link through there to the primary care booking site and go through that to book their appointments. It's important as well, as we're going through this phase and talking about vaccine coverage, it is of course linked to the province of Ontario's reopening plan. And as the Mayor said, it's our civic duty, our community duty to move forward and help with opening up the province and protecting ourselves, our family members, and our community. And there are key vaccine thresholds, including those for step 2 of reopening that are set at 70% of Ontario adults vaccinated with 1 dose of a COVID-19 vaccine and 20% with a second dose. So we want to keep that momentum going and help to reach our vaccine targets, which can ultimately support everybody through the reopening of our community. So as we move forward through this stage, it's important too to remember that people get their information about vaccination from lots of sources. Part of their support around vaccination also comes from their family members and their friends and talking about vaccination and the importance of it. So please do reach out, tell people why you chose to get vaccinated and about how critical it is and how important they are to you that they be vaccinated. So there's continued to be many locations for both first and second dose vaccine appointments, whether that's at one of our large scale clinics, our mobile pop-up clinics, local pharmacies, primary care settings. All of those are available to people. We know that our appointments through what we call the VAB, or the provincial booking tool, booked up very quickly this morning, largely with people interested in second doses. But our pharmacies will continue to have a supply come through to them. So please look to your pharmacies, and we'll continue to add additional appointments for the coming weeks as we get more vaccine coming through from the province, and have that clinic by Dofasco, our Celebrity South Dofasco, coming on board. That will come on board this week as well in terms of appointment bookings. And so please do keep checking back. There will be appointments that continue to be added. And remembering too, you do not have to have your second dose at the same site as you got your first dose, whether that's between our different clinics that we run, between a pharmacy and a clinic, between primary care or pharmacy. Any of those are options you can work through and figure out the one that is most convenient, most accessible, and right for you. The one thing to remember is that Youth 12 Plus, they still are, the only vaccine that they have available to them is the Pfizer COVID-19 vaccine. And so we do continue to have clinics that are targeted to youth where specifically the Pfizer vaccine is being used, but they too can go to a pharmacy that is using Pfizer vaccine. And we have many community-led mobile clinics that do have that vaccine and are a safe and effective way to get it. We have family and youth-friendly clinics beginning tomorrow at our Hamilton Health Sciences Wellington Street Clinic with some extra supports for kids if they have concerns about needles or pain control related to vaccine or any of those sorts of things. And as well, if you do have a child that has some specific needs and needs some extra supports, please work with your providers to get hooked into the clinic that is being run by McMaster's Children's Hospital to support kids who need extra care because of their special needs. So as I said, check back at www.hamilton.ca/vaccine booking. It's updated regularly with the most up-to-date information. Please do go through the portal online, call the provincial hotline if need be at 1-888-999-6488 if you need some help, and they'll be happy to get you booked in. Mr. Mayor, back to you.
Thank you very much, Paul and Elizabeth. And we continue our ongoing partnership with the province and with municipalities to work towards vaccinating as many people as possible. So do take us up on the offer to get the vaccine. It is, again, the most effective tool for prevention and protecting yourselves and others that you can do on behalf of your community. So my wife and I were blessed to have our second dose at First Ontario Centre Sunday morning. And I know the experience there was similar to experiences happening at all the other vaccination sites. seamless process, lots of energy in the room, friendly people, taking all the anxiety out of getting vaccinated, and making everyone feel like they're welcomed, and very efficient and very caring people there working out. People that have been seconded from the libraries and facilities to help facilitate all of this great work, and some docs and nurses administering the vaccine. All of them fantastic, and I really appreciate the effort they're all putting into not only just delivering the vaccine, but making people feel like this is an important day, and making them feel comfortable and happy about the experience. So well done on behalf of myself and my wife, Diane. And I know, again, it's happening in all the vaccination centers throughout our city. Our staff are just doing a fantastic job of making people get the vaccine that hopefully will put us all in good stead in the future. So continue on with that great work. And every vaccination gets us a little step closer to the step 2 of the provincial roadmap to reopen. So that's a good thing. I'm going to turn it over to Jen now for questions from the media. Jen Racine.
Thanks very much, Mr. Mayor. We have 2 media partners joining us today for the media briefing. As usual, we'll start with 1 question and 1 follow-up for each reporter. First question goes to Christine Rankin from CBC Hamilton. Christine, you can go ahead.
Hi there. Thanks so much for taking my question. And this one is for Dr. Richardson. I think with each wave that comes along, folks are wondering, is this the last one? And I think people are wondering now if we finally crossed that threshold into a final decline, especially with 11 cases today. That seems like a good sign. So how out of the woods are we?
Thanks very much, Christine. And so this was actually a question that was also asked at the Board of Health, was this the last variant we would see? And would this mean, that we were on that steady decline downwards? And while we're definitely in a great place where we have got lower numbers and our vaccine coverage is coming up, we are going to need to continue to monitor and see what happens from here. The good news is you generate less variants by having less people having cases, because it is that number of cases, the amount of virus that's out there, that allows it to continually evolve and change, which is what all viruses do, and allows the generation of new variants. So we'll keep monitoring it. It may be that it becomes somewhat like influenza, where it changes every year a little bit, and so we need to develop a new vaccine and get a new vaccine each year. It may be something where we can build immunity that lasts for a long period of time, no matter what happens with the virus. So we'll be monitoring that, as is the whole world, as we go forward in providing advice. But for now, the best thing you can do is get vaccinated, bring those case numbers down, keep them down, protect yourself, protect your family. And in the meantime, while we're working through that, continue the public health measures, stay home if you're sick, wear your mask, keep that safe physical distance.
Thanks very much, Dr. Richardson. Christine, any follow-up question?
Yes, thanks so much. This is also for you, Dr. Richardson. I know there's been information shared over the pandemic about, how a vaccine's effectiveness changes or increases depending on the weeks that go by. And so I was hoping you could kind of give a refresher on, what the most effective delay between dose 1 and dose 2 for the different vaccines that are out there. And if you have to keep this in mind when you're kind of bumping up that second dose.
Sure, absolutely, Christine. So there's the 3 different vaccines. They all have a slightly different interval between the vaccines. And of course, for most of us working off that product monograph, as we call it, the information that the vaccine manufacturer provides, that gives a good interval in terms of establishing a good coverage with that vaccine. And that's been proven through studies. And so that's where we see that 3 weeks with Pfizer, 4 weeks with Moderna. And so that's been simplified to say at 4 weeks with those mRNA vaccines is a good timeline to get vaccinated. Of course, there is some evidence that the longer you leave even that period for those vaccines, the better your vaccine immunity is your virus immunity is in the long term. And so, we're talking at rates that are really quite good already. With AstraZeneca, the difference is that there really is somewhat of an increase that happens the longer you wait. So 12 weeks was felt to be the sweet spot, if you will, around when to get that second dose of AstraZeneca vaccine. But of course, we're talking about an environment where variants do continue to be generated at a significant pace. And so getting the bump up of a second dose coverage a little earlier is a trade-off that needs to be considered in that context. And then we'll be seeing in the long term whether there are booster doses or that sort of thing that might be needed for these vaccines. So that's kind of the timeline information at this point.
Thanks very much, Dr. Richardson and Christine. Next question goes to Joanna Furketich from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. I hope everyone had a great weekend. Dr. Richardson, we in Hamilton were not chosen as one of the Delta hotspots. And at Board of Health, I know you said that that was a reasonable decision, but how do we know how much Delta there is in Hamilton, considering it does take this genome sequencing? It's a long process. You know, the information about variants was removed from the website because it wasn't felt to be accurate. I haven't really seen anything from the province that shows the data that they use hotspots. So like, how do we know how much Delta is in Hamilton and that we aren't one of the hotspots?
Thanks, Joanna. So it's a good question. You'll see two different ways of looking at where the Delta variant may be going on, maybe transmitted around. Right now, one of those is by Public Health Ontario, who, as of last week, started testing 50% of every sample every positive sample of COVID-19 with that whole genome sequencing. So they're trying to establish where is it, what's going on, as well as detect any other variants that may be being generated. And so that is going to give us good information about what is going on across the province. At the same time, the science table is using a slightly different way of looking at it to say, well, you know, if we know what are the alphas, if we know what are the some of the other variants, you know, what's left must be either the original virus or the Delta variant. And so that's where they're putting forward some estimates about what is going on where. And so I think it's that sort of information that's being used to determine where that Delta virus is right now. We don't right now see a lot of that happening here in Hamilton. And so we're quite pleased to not be included in that group. We'd like to have those lower rates of the Delta variant and have vaccination rates go up instead, which will continue to have those stay down. So as we go forward, we'll continue to learn more from the detailed work that is being done by Public Health Ontario, as well as see where those estimates are at this point from the science table.
Thanks so much. And my next question, I was hoping, Dr. Richardson, you could talk a little bit about the condition the very rare condition that's being seen with kids with the Pfizer vaccine, as I'm sure there's a lot of parents who, have that top of mind as they're trying to make their decision. Have we seen any cases of that here? And can you talk about what message you would like to get out to parents about that condition?
Thanks, Joanna. Yes, an important thing to talk about. And so this is pericarditis and myocarditis. So two long terms. What they really mean is inflammation of the lining around the heart and inflammation of the heart muscle themselves. And so in some areas in the US in particular, they have seen increased rates than would be expected, because these unfortunately are two things that do happen at times for people. They can develop this inflammation, usually due to a virus that affects the heart or the lining around the heart. And in some areas, they had seen that happening at higher levels than would be expected amongst people who had a dose of the vaccine, more commonly after the second dose of vaccine rather than after the first. Still a very rare finding here in Canada. We have not seen that in relation to the vaccines that are being given here. And that is very good news that we're not seeing that. We're always monitoring for those safety signals through the monitoring systems that exist. And we will continue to do that, since we know, though, that COVID-19 itself can have very significant consequences, including in that age group that are experiencing the myocarditis and pericarditis. We still find in favor of the vaccine in terms of safety and protection and coverage, and recommend that people do go ahead and be vaccinated to prevent the very serious consequences that can occur with COVID-19.
Thanks very much, Joanna and Dr. Richardson. We do have a bit more time, so we will go back through the reporters once more if each reporter would like to ask another question and a follow-up. First question goes back to Christine Rankin from CBC Hamilton. Christine, do you have a question?
Sure, yeah. Thank you for the extra opportunity. This one would be for Paul Johnson. I know you mentioned that the gatherings that were indoors over the weekend were smaller kind of compared to the previous summer. And do you think there's been a change in perspective, or is this just one good weekend?
Short answer is I don't know for sure. I think the big piece of it is this weekend was good weather and you can have 10 people outside. So I think that takes away a little bit of the potential for people to be gathering indoors instead. So I think the fact now that the outdoor gatherings are getting larger in size and people can see where we're headed with this, it's good news. We need to get prepared. We're going to have the opportunity to be indoors with people in the not too distant future. I think all the trending heads in that direction, whether it's actually 21 days exactly or whether it's some other date it's coming. So we'll prepare for that. But in the meantime, it's great weather. People can have more people gathering outside. I think that plays into it a fair degree, and we're really thankful for that. So typically we've been driven by, these are complaint-based calls. We don't go proactively door to door, obviously. And so the large indoor gatherings must not be happening at the same level, because people are pretty quick to let us know when they see something happening that they just know is well beyond this. So thanks to the community for their continued support of this. And this is what will allow us to keep this thing moving in the right direction.
Thanks, Paul. And Christine, any follow-up?
Yes, and thank you again. This would be for Dr. Richardson. And are there any concerns that there might be a bit of a log jam, I guess I'll call it, later in the summer with students trying to get vaccinated before September, but then also other adults who are moving their appointments?
Thanks, Christina. This whole piece about sequencing and moving people through and trying to move through first doses and second doses as quickly as we possibly can, because of concerns around things like the Delta variant, and as well wanting to have kids and everybody vaccinated by the end of the summer. We're very hopeful with the kinds of supply numbers that the province is indicating they are seeing from the federal government that that's not going to be a concern, that you'll see there continues to be more and more channels open for people to be vaccinated with pharmacies. And the goal is to have every pharmacy that was giving flu vaccine to have them up and giving the COVID-19 vaccines. There is a goal to move more vaccine into primary care so that you can go to your family doctor. We do know when we've talked with people that conversation with their family doctor is a very critical one as we go forwards. And so we'll want to have that route especially be established and working well over the course of this summer. And so, there's going to be many, many different ways to get the vaccine and lots of supply coming through. So I think it's still going to take a little bit of patience and time for us all to get vaccinated, but anybody who wants to have a vaccine should be able to have one by the end of August and ideally have both their doses by the end of August.
Thanks very much, Christine and Dr. Richardson. Next question goes to Joanna Furkedich from The Spectator. Joanna, do you have a follow-up? Joanna, you are on mute. Joanna, any follow-up question? You are still on mute.
Sorry, I'm not sure why I was having trouble getting unmuted there. Sorry about that. Thanks so much for the opportunity. Dr. Richardson, we still have a very high test positivity here in Hamilton. Is there any answers yet on why we are seeing that? The provincial talked about how there is sometimes concern with the reliability of cases going down if test positivity doesn't fall with it. So, can you talk about why we're not sort of following the provincial trend with test positivity going down, the way it is in the province?
Yeah, thanks, Joanna. Absolutely. It's one of the markers that we follow along with our actual case numbers and our numbers of outbreaks and all of those sorts of things. And we know that the kinds of testing that we were doing, whether it was related to students who were in schools back when schools were still in, or the increased amount of testing that we did with contacts when the new variants came in, because we're managing every case as if it was a new variant and using strict measures in every single case. that it really did generate a high volume of tests, and those volumes of tests have come down as well. So it may just be that the group of people that are going forward now for testing, are particularly those who are having symptoms, and then we're identifying a larger number of cases at this point in time. But overall, our case rates are doing very well. They're coming down. As I said, our outbreaks are going down. So we can't just look at one indicator, but look at many indicators, and the rest of the indicators are quite supportive in terms of drops. And so we will continue to look at it, continue to make sure people have access to testing, because that's, of course, a critical thing. And ultimately, as we move forward, what are the ways that people can get tested? Because that too will be ultimately undergoing some sort of transition, and while we're continuing to look at access being key.
Thanks so much. And the next thing I wanted to ask you about was Moderna, because I know some people have been having a lot of trouble finding that second Moderna dose. And on the website right now, it only lists Winterberry as a place where you can get it. So can you talk about, where people can get that Moderna dose, and should they opt for Pfizer right now? Like, is there going to be Moderna available for them, or should they just go to Pfizer?
Thanks, Joanna. A really important point, because this interchangeability between the Pfizer and the Moderna vaccines is going to be really key, I think, over this summer. You're going to continue to see a steady supply of Pfizer, and we're going to have, I think, a pretty significant supply of Moderna as we go forward. When you look at some of the numbers that the federal government has been putting out there in terms of supplies and contracts that were made. So we do see that there will be more Moderna coming on the horizon if people want to wait and get their second dose as Moderna. But it is quite safe and quite advisable to use whichever of the mRNA vaccines that is available when you come to be vaccinated. So I wouldn't be concerned at all if you need to go to a Pfizer vaccine if you had Moderna the first time around, or to Moderna if you had Pfizer. They really are, as the National Advisory Committee on Immunization has said, as our provincial government has said in their reviews, are quite safe, quite okay to interchange those vaccines. And so the best thing to do is to take the vaccine that you can get when it's available to you.
Thank you, Joanna and Dr. Richardson. With that concludes our media questions for today. Mr. Mayor, I'll turn things back over to you. Thank you.
Thank you very much, Jen, and thanks to Bill Custers and the entire team at Cable 14 and Clear Cable for helping us put these media advisories together and keep them smooth running. And to the media partners who asked the questions and share this information with the broader community, very much appreciated. It's the best way that we can get information out to them, hopefully accurately and frequently. So do your part, book your vaccine, that we can continue to move forward to the provincial roadmap to reopen. And as always, if you want more information, need more information on COVID-19, whether it's the financial supports or any updates, visit our website at hamilton.ca/coronavirus. And please continue to follow all the public health measures, whether you've been vaccinated or not, myself included. Masking and physical distancing is still going to be important, given that there are other variants out there that could continue to escalate, that we just don't want to have spread in our community. So if we get vaccinated and you've had your second dose or first dose, continue to follow those public health measures to protect not only yourself, but others from any additional spread in our community. And while we're at it, we will be back here next week on Monday, June the 21st at 3 p.m. for the next media briefing. So thank you for tuning in today. Look after one another, be kind to one another, check in on your neighbors and friends, and stay well. See you next Monday.